Seasonal affective disorder is another mood disorder that is common to see, and it's particularly in some regions of the country. I gave the example in class talking about Alaska, where there's times where there's periods of time where there's 24 hours of darkness. You see this also in other areas where just the overall the days start to shorten. For instance, obviously like in the late fall and winter, the decrease in sunlight in some individuals affects their circulating levels of serotonin. Again, that important neurotransmitter that we had talked about. Your typical signs and symptoms of some of the stuff you see with this are individuals, look to sleep more. They feel tired. Their food intake changes. They have a tendency to gain weight, become very irritable. It is more common in females, and as I had said, it's seen even more in those northern latitudes when there is an extreme lack of sunlight. The treatment for this, in addition to psychotherapy and meds, involves actually using artificial light. So people will have lamps, UV lamps, in their homes to kind of allow themselves to absorb more light, and that could potentially help in mitigating some of the effects from this. So now this takes us into looking at different types of anxiety disorders. So phobias are essentially abnormal fears that produce a lot of excessive angst with people, and typically this revolves around some type of adverse life experience. So many times individuals will, say for instance they had a bad experience with a dog when they were younger. Well, that would make them potentially afraid of dogs. Your indicators of this, so one of the things you typically see with this is an extreme physical avoidance of whatever it is that the person is afraid of, and there's various types of phobias. As far as treatment, there is medication for this. They also do something called systematic desensitization, which is a gradual controlled exposure. So, going back to the previous example, if someone has a fear of dogs, maybe what they would do is, sit the person in a room and bring a small dog into the room. And then they would teach the person relaxation techniques in order to deal with that. Then the next step would maybe be they'd have the dog come and sit by the person. Next thing, they'd have the person pet the dog, and all within that have the person go through relaxation techniques in order to gradually work and kind of suppress that anxiety that they have, and then gradually work to maybe doing it with a bigger dog. Another example of a phobia that you could sometimes see is just generalized anxiety disorder, and this is the person that actually suffers severe panic attacks that many times will kind of mimic a cardiovascular event, and they just have extreme intense anxiety, particularly in certain situations. All right, another anxiety disorder is obsessive compulsive disorder. So two parts to this. The first part is the recurrent thought or irrational or unreasonable fear. That's the obsession. The compulsion part is the actual behavioral part. So for instance, the person who is excessively worried about getting robbed, so that's the obsession. The compulsion is they lock and relock their door because they keep thinking that they didn't lock their door. And there's various other things associated with this. It can coexist with depression. There is the potential for there to be a serotonin deficiency. So in these instances where you're seeing that there's a serotonin deficiency or some other type of neurotransmitter issue, those are the conditions that will typically be able to be treated with some sort of medication. And there's also other types of psychotherapy and behavior modification that could accompany this as well. All right, looking at dissociative disorders, so again, this falls under anxiety disorders as well. This is a sudden change in identity or behaviors, and this will occur as a result of some type of extreme physical or mental abuse, or even a severe injury or extreme emotional state. So this is the multiple identities, okay, or the multiple personalities. So, and where it may even push the person towards is forming complete amnesia about something. So basically what happens is the person develops these other identities as a way to try to escape these abusive situations, or to try to forget about these severe instances in life where things had happened. The treatment for this is very complex. It can involve medication. Psychotherapy is usually done as a way to kind of reintegrate your book talks about how you look to reintegrate the personalities into one single personality. So basically, the psychotherapy that gets used for this. And again, be mindful of the different types. When we say psychotherapy, behavior modification, these are all different types of counseling strategies for all these different things. So make sure you're noting in the disorders which ones are effective for some of the different conditions. But the psychotherapy for this looks to merge the identities, so to try to bring the person back to the one personality or the one identity, if you will. Okay, somatoform disorders, so this is actually a classification of disorders, so this isn't like an individual type of condition. It's a grouping of disorders, and we're just going to kind of talk about them in general. We're not going to discuss individuals. Like, for instance, with the anxiety disorders, we talked about phobias and obsessive compulsive and dissociative disorders. They all fall under anxiety disorders. I'm just going to make mention of somatoform disorders in general. And somatoform disorders involve imposing physical, when a person imposes physical conditions on themselves. So this is the person who more or less, feels like they have these various health maladies, but doesn't really have them, and they more or less impose these conditions on themselves. They're basically, many times when you have somebody that has this, they'll have very vague complaints, or they'll exaggerate things. When you're going through their medical history, they'll be kind of inconsistent and all over the place. They'll many times have recurrent complaints. So these are some of the things that you'll see with it. Some of the risk factors for this are here: overprotective family members, unresolved conflicts, again, major life events, abuse. These are all things that can certainly contribute to this. One of the keys is when you're dealing with any type of somatoform disorder, and in the beginning of the chapter, I gave some examples of somatoform disorders, and the table at the beginning of your chapter has some further examples of them, so make sure you look at them and you could recognize them. It's like things like malingering, the conversion disorder, as we discussed in class. Those are all somatoform disorders. Never assume that they exist. So, as a medical professional, treat your patients, but, again, to yourself, kind of make note if you feel like, something doesn't seem right after some time. You certainly want to make sure that you refer to counseling as needed. Again, make sure, though, that initially you don't just right away just assume that this happens. So never assume it exists. Treat them, give them appropriate clinical treatment for what they have, and then if necessary, give appropriate medical referral when you feel the time is appropriate. Personality disorders are a group of disorders characterized by recurrent antisocial behaviors. Again, there are some examples of personality disorders on the table at the beginning of your book, and I did give some examples at the beginning of the discussion in class as well. Borderline personality is probably one that you'll hear a lot about. In borderline personality, one of the hallmark signs of that is an abnormal dependence on other people for psycho-emotional stability. A really interesting special on the NFL Network, they had a Football Life, and they did it on Brandon Marshall. So Brandon Marshall is a big spokesperson for borderline personality, and that's because he was diagnosed with that. So it was kind of interesting to watch him go through that. And one of the actually interesting things that came out of that was his connection with Jay Cutler when they played together in Denver, and some of the issues that happened when Jay Cutler left Denver. It was it really impacted him pretty significantly. So some of the risk factors associated with this, with personality disorders, family issues, again, very similar things we've talked about before: family issues, abuse, neglect, various inheritance trait. When you're dealing with personality disorders, treatment-wise, It's very difficult. You cannot use medications with personality disorders. They're not effective because they don't really have individuals with this. There's no chemical imbalance, if you will. So treatment primarily just involves psychotherapy. You do not treat this with medications, again, because there's no problem as far as the neurotransmitters are concerned. All right, psychoses, probably the most common condition associated with psychoses is schizophrenia. Psychosis is a disorder involving orientation to physical surroundings. So one of the characteristics of this involves hallucinations, and the hallucinations can be visual, they can be auditory. So in other words, people could hear voices, they could actually physically see individuals or things around them, or they could be hearing noises, they could be sensory based. So this is basically what happens, and usually there's a major lack of logic to the way these people feel about things. They can be extremely paranoid about certain things. As far as the causes of this, neurotoxicity, so something that has chemically affected the neurological system, drug use withdrawal, high levels of dopamine. So you saw with some of the other conditions, there were low levels. This is high levels of dopamine. Increased electrical activity of the brain are all things that can cause this. Treatment-wise, you basically have to find the underlying cause of the psychoses. So if there's a chemical imbalance, obviously you can use a medication to treat that. If there's something else that has done this, if it's drug use, obviously you go through some means of trying to get over the drug use. So it's basically just looks at the cause of the condition. Okay, wrapping up with the pediatric conditions. So child abuse, very important to be able to recognize signs of this, particularly in certain work environments. So child abuse, any behavior that interferes with a child's development, and it could be, there's all different types of abuse. I mean, right away, typically people think of physical abuse. Certainly there are other ways in which, you could have child abuse. One of the things that's very common with this is that the child's role many times changes. Common presentation of that is, for instance, maybe an older sibling in a family where there's multiple children. The older sibling kind of takes on kind of a caretaker responsibility, so they almost take on more of an adult role in that situation. There's different manifestations of child abuse, as I had stated. Neglect is probably the most common and the most commonly reported. So neglect could again be any time there's physical, emotional support taken away from the child. Again, could be very detrimental. As far as presentations of this, you kind of also look at the ways in which just the family dynamics are. So like many times the family may isolate itself to avoid contact with other authority figures. So the adults kind of isolate the family from other people in an effort to kind of hide some of the issues. Many times you may see situations where parents have very high expectations for the child. So there's various ways in which this could be. Your book will give some other examples, so make sure in the reading to make note of some of those. So very important, be able to identify different types of abuse. So physical abuse, obviously there are specific things as far as physical injury that you could recognize. So skin injuries, cuts, bruises, things like that, many times hidden. So they kind of occur in odd spots where you don't necessarily have from obviously we're dealing with active individuals. So important to look out for that. As far as neglect, you can look for signs of malnutrition, fatigue, poor hygiene, poor school attendance. Those are many times some things that you can see with this. As far as treatment in suspected cases, make sure, obviously, from your standpoint, if it's something that you've recognized, be sure to be calm and supportive to the child, making sure that, obviously it's very troubling to go through. Treatment may could involve medical treatment if there actually are physical injuries. Removing the child from the family. There's also counseling efforts that could be made to kind of correct the situation. One thing to note, it is a requirement for healthcare workers to report child abuse. So you basically become a mandated reporter in these situations if you suspect. So if you suspect child abuse, make sure to do so. It is a law, and you are a mandated reporter for this. So it's very important. Careful documentation, physical exam findings. So make sure that you note various things, because it does require you to report this. Then behavior and conduct disorders. So these are different types of psychological social disturbances in individuals. Antisocial behavior is a very common presentation of these different behavior and conduct disorders, and usually this is a result of an unstable or an abusive home environment. If you don't have good adult role models in the family, these are all things where this type of behavior could be manifested in young children. Many times a child with behavioral or conduct problems develops a limited sense of responsibility, so they tend to become very irresponsible. They don't take responsibility for their actions. So when they do kind of act out, more or less, they look to blame others for their behavior. So they never really take, so it's a lack of accountability becomes a huge problem in individuals who have these behavior and conduct disorders. As far as treatment goes, psychosocial interventions are very important to kind of get them through a lot of those psychosocial issues, so that they could constructively interact with their peers in particular, but just with people in general. So that could also include family psychotherapy if there does seem to be an issue within the family, that could be addressed through that way as well. So various counseling means can be used in treating the behavior and conduct disorders. And these are the learning outcomes from the chapter. So again, make sure, as I stated in class in the introduction, look at the different tables that I had discussed. So I introduced the topic with the various categories of psychological disorders. So the different types of substance abuse, the disordered eating disorder, the mood disturbances, anxiety disorders, somatoform disorders. So understand those different categories and the specific disorders associated with them. Okay, so for instance, anxiety disorders, you have phobias, panic disorders, obsessive compulsive disorder. So those are examples. Somatoform disorders, you have hypochondria, you have conversion disorder, you have malingering, you have Munchausen syndrome. So those are all different types. So make sure you could identify and categorize those disorders. Okay. So that's a part of the learning outcomes. Again, obviously signs and symptoms related to them, and specific medical history findings would be important as well.